Today I want to demonstrate how to redress your toe after surgery. You're going to be issued with 4 different types of things that we use for dressings. Firstly, it's called Effigem. Effigem is a cleaning product. So wherever the wound is, we want you to cover 3 or 4 sprays right into the area. After that, we want you to use the gauze, which you'll get as well. And in that, you just need to literally wipe it. After that, you're going to be given 2 other products. One is called Podlin. It comes in a big box like this. I would normally get to cut it in half like this. So you've got 2 sides of it. And the second is MeFix or Podfix, and that comes in the box there. Next thing what you do, you'll cut about 5 inches of tape. And then again after that, I cut it in the middle. So therefore you got 2 pieces of taping. Pull out the tape. Then I would tape it so it's halfway across the dressing like that. Then I'll anchor it across, put it over the toe, and just simply wrap it around like that. That way you've got a nice secure bandage. Now with the second piece, you'll open it up and then literally put it on top, just wrap it around, and then you can tuck in the top like that. That is nice and secure. Now the idea of dressing the toe is not to tighten it so it doesn't come off. I'd rather you leave it quite loose, nice and relaxed. Therefore, it allows the toe to breathe, but also you're not compressing the tissue underneath. So dressings are supposed to be done every day. You would use the cleaning agent and the gauze and redressing it once a day. If you need to do it twice, not a problem, but just do it on a daily basis without fail. People often ask us when to stop. We don't want you to stop. Carry on until the practitioner who is looking after you will tell you what to do, when to stop, and when the area is healed. And that's all I want you to do, and it should be good. Thank you.